I'm Dr. Deepthi Kancharla, consultant surgical oncologist. Today we are going to talk about breast cancer. So first we'll know what is breast cancer. So normally the body is made up of cells which usually grow under the control of the body. So sometimes what happens, these cells grow out of control of the body. That is when cancer develops. So whenever the cells in the breast grow out of control, usually you see it as a lump in your breast, which is most commonly presenting as cancer. So usually the breast is made up of lobules, that is called a tissue where the milk is produced, and ducts, which are the pipe-like things that carry the milk from the glands to your nipple, and connective tissue. It is nothing like a cement that holds these globules and the ducts together, and it gives the shape to your breast. So where the cancer arises, that determines the type of cancer. So if it comes in the lobules, that is called lobular cancer. If it comes in the ducts, that is called ductal cancer. And there are other types called Paget's disease of the nipple, which you usually see it as some ulcer or itching or redness on your nipple. Or there is another thing called inflammatory breast cancer, where there'll not be any lump in your breast, but there'll be redness of the skin over the breast, and there'll be pain over the breast. So these are the common types which we usually see, but there are many other types of cancers which can occur in the breast. Age is mainly a risk factor for cancer for any organ. So likewise, for breast cancer also, getting older is one risk factor. And the second one, usually the breast tissue in our body is sensitive to a female hormone called estrogen. So whenever there is increased estrogen in the body, that sensitizes the breast cells so that it grows out of control, leading to cancer. So what are those conditions where this estrogen is increased? First thing is early menarche and late menopause. So usually the menarche is attained by 11 to 12 years. If it occurs before that and your menopause gets delayed beyond 55 years, that is one risk factor. The other thing is nulliparity, which is nothing but not having children. Then not breastfeeding the baby is another risk factor. And intake of OC pills, like oral contraceptive pills, which are usually taken for contraception, or hormone replacement therapy, which is nothing but supplementation of hormones after menopause. That is another risk factor. And exposure of radiation to the chest before the age of 30 years for any reason. Usually radiation is given to the chest in a condition called Hodgkin's lymphoma, which is a type of blood cancer. So that is another risk factor. And obesity and overweight is another risk factor, because the fat, whichever is accumulated, gets converted to a female hormones in your body, which again sensitizes your breast cells. And alcohol intake. So intake of alcohol, it causes damage to the liver, which usually maintains the balance of hormones in the body. So whenever you take alcohol, this liver gets damaged and the hormonal balance is disturbed. So that causes cancer. Another risk factor is having a family history. That is, if any of your family member, especially the first degree relative, that is your mother or your sister, and second degree relatives like your grandmothers, either on your father's side or mother's side, can be another risk factor for breast cancer. Usually it presents as a lump in the breast, and most commonly it is a painless lump. And second, there'll be inward turning of your nipple, or there'll be a discharge from the nipple, usually bloody discharge. It will be a blood or some white color discharge or brown color discharge. Or there can be a redness of the skin over your breast, or there can be a change in the shape or size of your both breasts when you compare them, or they can present as a pain in any part of your breast. Or sometimes it might present as a swelling in your armpit. Your breast will absolutely be normal, but you will have a swelling in the armpit. That is also one of the symptoms of breast. But mind you, presence of any of this will not tell this is a cancer, but they can be a presentation of cancer. So whenever you have these symptoms, just go to your doctor and they'll let you know whatever it is. There is no hard and fast rule that cancer develops only at this age. It can develop at any age. Most commonly, we see cancers after 50 years of age. But you can develop cancer at any age. I have seen someone who has developed at 16 years of age also. So it's always better to be cautious of your symptoms. Mammogram is nothing but an X-ray of your breast. In simple language, So what they'll take an X-ray of your breast, you'll get a picture, and the radiologist will see if there are any lumps in your breast, or if there is any abnormality in the other breast where you don't have any lump, and accordingly they'll diagnose it and then proceed for treatment if there is anything abnormal. Usually, we recommend people to start taking that screening mammogram at the age of 40, and you have to take the mammogram every yearly. So if there is something abnormal in the mammogram, based on that abnormality, we'll change the duration. So ideally, you should start at age of 40 years, and that should be done every yearly. There are different treatments like surgery, chemotherapy, radiotherapy, hormonal therapy, and targeted therapy. These are all the treatments of breast cancer, but which should be taken first and what is the sequence of treatment? It depends on the stage at which you are diagnosed. So finally, the stage decides the sequence of treatments, but all the patients has to take almost all the treatments to complete the treatment. There are some factors which cannot be changed. As I told, getting older, we cannot change it. Getting early menarche and late menopause, we cannot change it. And family history also, we cannot change. But there are certain factors which we can surely modify so that the risk can be reduced, like maintaining a healthy weight by balancing proper food intake and having proper exercise, and by avoiding alcohol intake. It's always better to stop taking the alcohol. But if someone who is addicted to that, it's always better to limit it to 2 drinks a day. And being physically active, doing exercise regularly is one of the factors which can reduce. And if there is any history of cancer in your breast cancer in your family, especially, it's always better to consult a doctor. So there is something called genetic counseling. So running the cancer in family is usually because of mutations in the genes. So if you consult a doctor, they'll let you know about the genetic counseling. And if any test is needed, they'll advise you accordingly so that the risk can be reduced. And as I said before, oral contraceptive pills and hormone replacement therapy are also risk factors. So if there is any need to take these medications, you better consult doctor and ask them about the risks and benefits and take them accordingly by their advice.